নমস্কার, দেখছেন কলকাতা টিভি, সঙ্গে রয়েছে আমি স্বর্ণালী। আর আজকের আমাদের অনুষ্ঠান ডাক্তার বলছেন সকলকে জানাই স্বাগত। আজকে আমরা যে বিষয়ে আলোচনা করব সেই বিষয়ে আলোচনার জন্য এই স্টুডিওতে ইতিমধ্যেই উপস্থিত হয়েছেন অ্যাপোলো হসপিটাল চেন্নাইয়ের অর্থোপেডিক সার্জন ডক্টর পি কার্তিক আনন্দ। আপনাকে স্বাগত জানাই ডক্টর আনন্দ আমাদের এই ডাক্তার বলছেন অনুষ্ঠানে। ডক্টর আনন্দ, what I want to ask you at first that what is arthroscopy and what is the sports medicine in the field of orthopedics?
I am Dr. Karthik Anand. I am an orthopedic surgeon from Apollo Hospital, Chennai. So I am specialized into arthroscopy and a sports injury specialist. So to the first question, the answer to the first question is arthroscopy is a branch of a field from the Department of Orthopedics. So arthroscopy is a sports injury where the keyhole surgeries are being done. So that's the world which is called as an arthroscopy. So arthroscopy and a sports medicine, this has become as a separate department from the field of orthopedics. So where this department of arthroscopy and sports medicine uniquely treat the players, where the sports injuries players, where they get any injuries to the related to sports can be treated here. So what is sports medicine? So sports medicine is a field where sports science comes into the role, where any players, sports players who get injuries, sports injuries, we find out what is the reason behind to get a sports injuries. So why did that player get a sports injuries and how can we prevent that? So that's the role of a sports medicine.
What type of the joints are involved in these injuries?
So depending on each sport, different joints are involved. If you take like football, most commonly knee is involved. And if you take into a contact sports like wrestling and mixed martial arts, a lot of shoulder injuries can happen, knee injuries can happen. So depending on each sport, any joints can be involved. But most commonly, the common joints which are involved is the knee, shoulders and the foot and ankle.
Then how could we prevent this?
So the sports injuries can be prevented with good sports physiotherapy, which is proper training. So if a player is prone to any sports injuries, so there comes a role with the sports science. So the sports science person will come and assess you, and they'll find out which joints is weak for you, which muscle is weak for you, and they'll give you a proper treatment.
And what are
Like
the treatments of these injuries?
So injuries is properly with rehab therapy, which exercises, and if it's any specific like a ligament injury happens in your knees specifically, then you go for an surgeries, which is a keyhole surgeries, as I said, an arthroscopy keyhole surgeries.
Post arthroscopy ligament surgery, after the sports persons can play?
Yeah, 100% after any sports injuries or following a surgery, all the players can get back to their normal competitive level of sports with a proper rehab of a sports rehab for 6 to 7 months of time, and then you can get back into your sports, whatever sports you are playing.
And what is the type of knee robotic replacement?
So knee robotic replacement is the one which is latestly, it's come like last 3-4 years it's been going on. So it's similar to the normal conventional knee replacement surgery what we do. Here the robot which helps us in calculating the cuts. So when doing knee replacement, you do as a cuts, the portion where the cartilage is gone, you take the cuts. So here the software with the robotic helps us to decide how much of cut has to be taken. So by getting a robotic knee replacement now latest, the patients are benefited by getting a precise surgery with an accurately and a faster recovery. So from the next day, the patient will be able to walk, and within a week's time, he'll be able to climb up stairs up and down, and his recovery will be much more faster compared to the normal conventional replacement surgery.
Why this is so much popular in patients?
See, because it's new, it's a science-driven this one, and with robotic there are very much results are proven that the patients are, the pain-free is much more better, and the recovery is much more faster compared to the normal replacement surgeries.
Can you please explain the recovery process?
So recovery process, see, generally following a post replacement knee replacement surgeries like a few years back, a lot of people what they have is knee replacement surgery is a very big surgery. Post surgery you'll have a lot of pain, you won't be able to walk for months, you have to be a bedridden. So those things all have completely changed now with the knee replacement surgeries. So with the knee replacement surgery, the next day in the hospital you'll be made to walk on the POD1, which is the day of after the surgery. By the third day and fourth day, you'll be able to climb upstairs up and down. This is a normal recovery process for a knee replacement surgery. By doing a robotic knee replacement surgery, what it makes is it makes your pain little more free. Generally, the pain recovery will be taken care by the pain management people in the hospital. But robotic replacement, what it does is the pain will be much more better compared to the normal replacement surgery, and your walking and your recovery will be much more faster, which will be like few days prior. But because it's a new science driven technology, lot of people are preferring robotic knee replacement surgery.
Exactly. আপনারা যারা খেলাধুলার সঙ্গে যুক্ত এবং অবশ্যই স্পোর্টস ফিল্ডে রয়েছেন তাদের ক্ষেত্রে আমরা দেখতে পাই যে বিভিন্ন সময় কিন্তু আমরা ইনজুরিজের মধ্যে পড়ি এবং সেই কারণেই অবশ্যই চিকিৎসকের পরামর্শ নেওয়া আপনাদের তো উচিতই। তার পাশাপাশি বিভিন্ন যে ধরনের এই সময়ের যে চিকিৎসা পদ্ধতিগুলো এসেছে সেই পদ্ধতিগুলোর সঙ্গেও কিন্তু আপনাদের সুপরিচিত হওয়া প্রয়োজন এবং সেই সংক্রান্ত বিভিন্ন প্রশ্ন কিন্তু আজকের আমাদের এই আলোচনায় আপনারা অবশ্যই পেয়ে যাবেন। ডক্টর আনন্দ, what I want to in the next question to you that what are the treatment about this injuries?
Treatment related to sports injuries?
Exactly.
So if you ask me, the one of the common joints which I said is the knee. So in knee, the common sports injuries, the ligament tear which happens the ACL ligament. So if you see a lot of people, it can be a sports injury or it can be due to any road traffic accidents also, or even if you fall down in your house also, the common ligament to get injured in your knee is the ACL ligament. So if you have a ligament tears in your knee, the common surgery what we do is a keyhole surgery by reconstructing the ligament completely new, taking a new graft from your thigh and reconstructing that into your bone. So this is completely done with a keyhole surgery. So post surgery immediately your recovery will be very fast and you need to do a good rehab if you want to get back into sports. But if you are into a normal housework and just going to office and anything, within 2 weeks you can go back to your office work and driving two-wheelers and car, everything can be done within 2 to 3 weeks of time. But if you want to get back into proper sports, competitive level of sports, then you need to do a proper sports training for 6 to 7 months of time.
আমাদের দর্শকরা নিশ্চয়ই আরো একটা বিষয় জানতে চাইবে যে আমরা জানি ইতিমধ্যে যে নি আর্থ্রাইটিস যে বিষয়টা সেইটা কিন্তু বেশ সমস্যাজনক এখন হয়ে উঠেছে বিভিন্ন আমরা দেখি সাধারণ মানুষের ক্ষেত্রে, শুধুমাত্র যে স্পোর্টসের সঙ্গে যারা যুক্ত তারাই নয়, তাছাড়াও সাধারণ মানুষের ক্ষেত্রেও ব্যাক পেইন থেকে শুরু করে নেক পেইন, there are many of problems as there. So how could we prevent this?
So the neck pain and the back pain are one of the very common problems now what we say we see day to day in our clinics. Like almost 80 to 90% of the patients who come with the neck pain and the back pain issues. So why does the neck pain and the back pain issues have been started is because of the bad postures. Nowadays with a lot of people into software, into using a desktop, laptop and mobile phones, because of your bad postures, what happens is the head tilts forward, which causes a lot of pain into the back muscles, the neck spasms, which leads to the lower back pain also. So to correct this from the bad postures, the way you have to sit, what I'm going to tell you is, if you're using a desktop in your office means, you need to sit in a proper chair, which is a height adjustable chair. And the second one is, if you're using a laptop or a desktop, the screen should be to your eye level. Only if the screen is to your eye level, you don't have to look down. Otherwise, when you keep looking down, all the muscles in the neck becomes tight, and this slowly changes your neck posture, which becomes the neck muscles become tight. And the next one is, when you're using a keyboard, you need to use a keyboard which is lower to your closer to your body at the level of the shoulders. Because if you keep your keypad on the table, then you have to take your hand up and keep typing like this. This also can cause pain to your shoulders. So there are a few changes which you need to do in your desktop table to prevent this ergonomic changes, can prevent the neck pain and the back pain.
Okay, actually the sitting posture is so much important.
Yeah, very much important.
But we know that the official atmosphere are not there for this times. So, then how could we prevent this?
See, basically in each and every office, they have to see this ergonomic placement, how the chairs are there and how the desktop.
Yes.
And if the person is using a laptop, then you need to give him a laptop stand so that the laptop is at his high level. So these are basic changes where the office has to give it for the employees so that they prevent them from back pain and neck pain. The other way is, you need to start doing some exercises. Every day morning when you get up, you start with basic exercises, at least 40 to 45 minutes of exercises, which can be of walking for 20 minutes and 20 minutes of stretches, proper stretches of your neck and back. People who are doing yoga, very good. but you need to do yoga and at the same time start with few exercises which is related to your posture, which is your neck and back.
Okay.
Very simple exercises. Every day when you do it, you can prevent from these pains and everything.
একেবারে অর্থাৎ ব্যথা থেকে মুক্তি পাওয়ার জন্য কিন্তু এক্সারসাইজটা যথেষ্টই মাস্ট এবং তার সঙ্গেই লাইফস্টাইলে পরিবর্তন আনাটাও কিন্তু যথেষ্টই ইম্পর্টেন্ট ডক্টর আনন্দ what I want to ask you that the lifestyle maintaining how this is important for these days.
See, lifestyle, a lot of people are not maintaining the lifestyle. So that's what I am saying is a lot of people know that's about the diet.
Yes.
So we follow the diet. If the weight increases, you follow the diet. But the most important part here is exercise.
Okay.
Exercise is one of the most important part. So what we say is, when you get up in the morning, you do a brush. So after you brush, immediately you do the exercise and stretches.
Okay.
Immediately before you go and take bath also.
Okay.
So you brush, you do the exercises for the 40
empty
minutes.
stomach.
Empty stomach you can do.
Okay.
It's a basic stretches. If you're having neck pain, the physiotherapist will teach you some exercises related to the neck. Do those exercises first. Get up in the morning, do it, and then you go take bath.
Okay.
At the same time, in the night also, before you sleep, do those exercises, which hardly takes 10 to 15 minutes of time.
Okay.
So when you do this consistently, the posture problem and your muscle tightness, everything will slowly go off. The role here is consistent. If you're consistent with one work, you will see the results.
Okay, and the food habits, Dr. Anand?
Food habits, if you are not eating in outside,
what kind of foods are
basic home food are
healthy
completely
food?
fine.
Okay.
Home foods are completely fine. People who take lot of outside food, what happens is when you take lot of outside food and non-veg or anything, there's a high chance for you to have an increased uric acid.
Okay.
If your blood uric acid level increases, those are when you can get sudden joint pains.
Okay.
So when your uric acid levels increase because of any non-veg foods, anything, a lot of foods can cause this uric acid elevation, which can cause sudden joint pains.
Exactly. That means what I want to ask you, Dr. Anand, that how could we manage the food habits then?
Yeah. So see, food-wise, it's better to have a control with what food you're having within diet-wise. Always home food is better. And then if you're facing any joint pains or some joints which you feel suddenly with muscle pains or anything, always check your uric acid blood levels. By checking your uric acid blood levels, if you know that your uric acid is high, you need to take few tablets to get your uric acid to a normal level and control with the foods. So that is one very important thing. And other supplements which you can take is the vitamin D, which is one of the very important supplements which everyone has to take, vitamin D. So vitamin D, lot of Indian population are having low vitamin D. So what happens is when the vitamin D is low, your immunity becomes low, your muscle pains, joint pains, cramps, all of these can happen because of low vitamin D. So please check your vitamin D levels also regularly, and if the vitamin D is low, start taking some supplements of vitamin D3.
And what are the foods of enriched with vitamin D? Can you please explain?
So vitamin D, if you ask me, the best way to get a good vitamin D
in natural way
is light, sunlight.
Okay.
So sunlight is the one of the very good source. So morning 8 to 9 is the best time where you can go and stand in the sun. If you take a morning walk, 8 to 9 is a good time. And in the evening time is 3 to 4. So these are two times where you can go morning walking with less exposure of the clothes. When your body is exposed, the more sunlight falls, the vitamin D is more. So that's one way. And the other way with food, if you ask me, it's with the egg, with oranges. Those are the little foods which can give you a vitamin D. Whereas a lot of Indians, we don't go in sun. So that's why a lot of Indian population are having low vitamin D3. So if you start taking some supplements, the vitamin D corrects it.
And Dr. Anand, what are the treatments as there? What are the injections? What are the type of the injections as there?
So if you ask me about the injections, there are a lot of injections have come today into the market. So the injections we can divide into 3 injections formats. So one, which is the latest one, is called as a stem cell therapy injections. So stem cell therapy injections are the injections which we take the patient's own blood and we put it into a machine where it rotates and it gives you a plasma, whereas a rich plasma cells. So these injections you can inject into the joints where you have any tendinitis issues or even into an arthritis, any arthritis problem, knee arthritis. This plays a very good role in reducing the inflammation and giving a good pain relief for the patients. But what are the conditions you can use these injections, stem cell therapy injections, you need to know. Because in knee arthritis, you can't use these injections in the severe stage format. In severe stages, these PRP injections or any other injections format is not going to work if it's a severe arthritis. Whereas if it's in a mild or moderate arthritis, these knee injections can work to a certain level. With a good physiotherapy, the patients will have a very good pain relief.
Then Dr. Anand, how to treat the knee arthritis?
Knee arthritis. So knee arthritis is one of the very big topic. So if to explain in a shorter way, so knee arthritis is the one where the knee has a line called cartilage, a smooth surface which is inside the knee, which is called as a cartilage. So when this cartilage degenerates, it gets broken, so the cartilage breaks off and the bone to bone starts rubbing. So this is called as an arthritis. So in arthritis there are different stages, mild, moderate and severe stage. So if it's a mild stage, if you find out there is a knee arthritis which is starting for you, then you go with good physiotherapy exercises. If your weight is little on a higher side, you reduce your weight and try to avoid sitting in the floor, Indian squats, reduce it little and do with good physio and exercises. If you maintain your lifestyle in this way, from the mild, you can prevent it from becoming severe. So that's one way. And people who are into moderate arthritis, so there's other way is you need to do good exercises, physio, that's the only way, and as I said, weight reduction. If it's into a severe arthritis where what happens is the bone becomes bent, where you call as a deformity, the knee starts bending. So if in that stage of arthritis where it's very severe and the pain is unbearable, you're not able to walk inside the house also even for few distance, then the best way is to get the knee replacement surgery. As I was explaining, knee replacement surgery we used to do, it's called as a conventional knee replacement. Nowadays the latest way is formed as the robotic knee replacement surgery.
Can surgery make the person fit?
Yeah. See, people who are suffering with the severe knee arthritis pain with the bone being deformed, with the knee replacement surgery, the knee becomes completely straight, the alignment of the knee becomes straight, and this helps them to really have a very good lifestyle wise and completely pain free. They can go out and everything. So the mobilization of the patients will be much better post surgery.
Exactly how we can keep our bone healthy, Dr. Anand?
Keeping bone healthy, the first way which I'll say is do exercise. Only if you do exercises, your muscles are going to be healthy. If your muscles are healthy, your bones will become healthy. By taking a good calcium tablets and good nutrition food, those all are not going to help you make your bones more strong. The only way to make your bones strong is do exercises.
And what are the common supplements for everyone?
See, common supplements, youngsters don't need any supplements. If you are above 40 and 45, you start taking with little calcium, and everyone, as I advise, everyone should start taking with the vitamin D3 supplements. So check your vitamin D levels every yearly once or 2 years once. If your vitamin Ds are low, start taking with vitamin D supplements. That's one of the very important supplement which I'll advise for everyone.
And the lifestyle maintenance is so much important, you said.
Yes. Yeah.
And Dr. Anand, what I want to ask you that this knee arthritis, how can the people generally or in natural way, they can prevent this thing?
See, if you are prone to knee arthritis, like if your parents, if your mom or if your dad had,
is this genetic?
Yeah, it can be genetic also. If your grandmother had a knee arthritis, there's a high chance you can get it. The chances are there. So if your family history of knee arthritis is there, then from the younger age, it's better to do little exercises. So keep yourself fit, that's all. If your weight is increasing, try to control your weight. And as I said, keep doing little exercises which is related to your joints, like walking, basic stretches and everything, so that your weight is in control, your physical activity will be better, you can prevent arthritis. This has to start from the younger age.
And Dr. Anand, in what stage the surgery is necessary?
So, knee arthritis stage 4. Stage 4 is the severe arthritis which I said. So in this stage 4, the arthritis will be very bad and your knee will be completely bent. So the bone is getting deformed. So in this stage what happens is the patients who are walking in with this severe arthritis, they'll be walking in a little waddling type of gait. So they won't be able to walk inside the house also. So these patients can really benefit with knee replacement surgery. They'll see a lot of pain free post surgery, where they'll be completely pain free and they can go out and walk and they do the normal work for the next 15 to 20 years.
Okay, so then what are your suggestion for common people?
Like in common basic to
Yes.
See, for common people nowadays, start doing some exercise. That's the main source which we say to everyone, all our patients. So start doing some exercises, everyone, which will be basically a morning walk for 15 to 20 minutes and 15 to 20 minutes of good stretches, which can be related to your neck and back or knee. So do these stretches every day so that you don't get any posture related problems or any joint pains. So that is my advice to everyone.
And what the special advice for the sports persons only?
Yeah, so for sports players, if you are into any competitive level of sports and if you are having any small joint pains or any injuries, immediately consult a doctor and take treatment to that, because if you neglect the pain in any joints what you are having, these can lead to a major issues like a major joint problems or major injuries to your ligaments, which will prevent you from getting back to sports at earlier stage. So that the best way is get your treatments treated at early as possible so that it doesn't become into a major issues.
And then actually I want to ask you, Dr. Anand, that how could we can healthy our bones, and the exercise are how much important it's?
See, exercising which will really help your bones. So if to make yourself healthy and make yourself fit, all you need to do is good exercise.
Okay.
So having a good nutritionist food is very important. At the same time, with a good exercise and morning walk and every strengthening exercise is very important to make yourself fit and make your bones stronger. So in Western culture, if you see, a lot of people still take a lot of walking. They don't take any transports also. Even if they walk for 3 kilometers or 4 kilometers to their work, a lot of people walk. So that's why when you see in the Western people, their bones are stronger, the body fit is much more better compared to our Indian population. So at least for us, if you take the morning walk at least for your job or for a small shops and anything, it's going to make you really fit. So try to walk as much as you can than taking a transport like a bus or a train.
Okay.
So more walking is much better, and good nutritionist food, which is like more vegetables and more of fruits, which is going to make your body fit, which a lot of nutrients are there.
Sports
injuries.
Then can you please share your experience with us?
Yeah. See, I'm into this field of arthroscopy and sports injuries for the last 8 to 9 years of time. So I'm seeing a lot of sports players who come. Everyone who come to me are with post-sports injuries. So where I go and I see in any academies, what I give them as an advice is, so for a sports player, you need to be fit at any point of your career.
Obviously.
To be fit, you need to be in a proper shape by doing good physio and exercises. So you know, in your sports, you know what joints are going to be commonly involved. Like I said, if you're a football player, there's a high chance for you to get a knee injuries. So if you are in a sport of a football, you need to do a good exercises which is related to your knee strengthening. You need to keep your knee in a proper shape with a good strengthening exercises so that you can prevent injuries. You won't know that you're going to get injury or not. By having a good muscle, proper strength and a proper shape, you can prevent sports injuries. But during the matches, if you fall, any twisting injuries happen, there's a high chance you will get injuries. But to a certain level, you can prevent these sports injuries by keeping your joints in a proper shape, your muscle strength in a good shape.
ওকে ডক্টর আনন্দ, থ্যাংক ইউ ফর দিস প্রোগ্রাম। অর্থাৎ আপনারা বুঝতেই পারছেন যে স্পোর্টসের সঙ্গে যারা যুক্ত এবং যারা যুক্ত নয় তাদের জন্য কিন্তু এই এক্সারসাইজ অবশ্যই লাইফস্টাইল মেনটেন যথেষ্ট ইম্পর্টেন্ট। এবং আজকের আমাদের এই আলোচনায় উপস্থিত থাকার জন্য থ্যাংক ইউ ডক্টর আনন্দ আপনাকে। এবং একই সঙ্গে আজকের আমাদের এই আলোচনা এ পর্যন্তই। দেখতে থাকুন কলকাতা টিভি, রাত দিন 7 দিন।